Injections, infusions, or tube feedings may also contain substances to which people are allergic. If the allergies of an individual have already been established, it is important that relatives who accompany them for admission to a hospital or emergency clinic inform medical personnel of such sensitivities. Allergic persons should carry among their identifications one of which their allergies are listed. This is especially important in cases of allergies to antibiotics or other drugs. Frequently, allergies are mistakenly diagnosed as other illnesses. One 19-year-old man cited by Dr. Mandel was told by a world-famous clinic that his symptoms were due to a psychiatric problem. Another well-known clinic diagnosed his trouble as low blood sugar. However, tests indicated that his asthma, as well as numerous food allergies, was due to chemical susceptibility to certain additives, preservatives, and colorings commonly used in processed foods. Heavy perspiration, nasal congestion, and other allergenic symptoms appeared when small amounts of hydrocarbons were introduced by injection. In talking with him, the physician found that the young man's sports car had a leaky exhaust, which might put fumes inside the car. When the condition was corrected in the automobile, many of the severe symptoms, the sensitivity reactions subsided. Some people can help themselves by merely avoiding substances to which they are allergic, as the person who responds to natural gas and has a gas furnace and a gas range. These may be expensive appliances to replace, but such drastic measures they will often pay off in the long run, in reduced medical bills. It should be cautioned here, though, that this substitution should be made only when medical tests definitely indicate fuel gas as the offending substance. In cases where substances cannot be eliminated, as with household dust, molds, common pollen, etc., injections of tiny amounts of these materials given over a period of time may desensitize the patient. In the event that you or any member of your family may be experiencing symptoms that you suspect might be allergic in origin, you will be interested in the following table that Dr. Mandel presented to the second annual convention of the International Academy of Metaboology in New York City in March 1973. The subjective symptoms and objective signs that have been elicited by provocation techniques may involve every body region or system. This is a list of the most common reactions induced by testing. It also indicates the symptoms and syndromes experienced by allergic individuals after exposure to foods, beverages, inhalants, and a variety of chemicals. These symptoms are not always due to allergy, but they often are unrecognized, controllable, reversible manifestations of allergy that are misdiagnosed as idiopathic, essential, functional, of unknown etiology, of psychosomatic origin, or a response to social stress. Symptoms induced by provocative testing: skin, itching, burning, flushing, warmth, coldness, tingling, sweating on the back of neck, etc., hives, blisters, blotches, red spots, and pimples. Ear, nose, throat, nasal congestion, sneezing, nasal itching, running nose, postnasal drip, sore, dry, or tickling throat, clearing throat, itching palate, hoarseness, hacking cough, fullness, ringing or popping of ears, earache, intermittent deafness, dizziness, imbalance. Eye, blurring of vision, pain in eyes, watery eyes, crossing of eyes, glare hurts eyes, eyelids twitching, itching, drooping or swollen, redness and swelling of inner angle of lower lid. Respiratory, shortness of breath, wheeze, cough, mucus formation in bronchial tubes. Cardiovascular, pounding heart, increased pulse rate, skipped beats, flushing, pallor, warm, cold, tingling, redness or blueness of hands, faintness, precordial pain. Gastrointestinal, dryness of mouth, increased salivation, canker sores, stinging tongue, toothache, burping, retasting, heartburn, indigestion, nausea, vomiting, difficulty in swallowing, rumbling in the abdomen, abdominal pain, cramps, diarrhea, itching or burning of rectum. Genital urinary, frequent, urgent, or painful urination, inability to control bladder, vaginal itching or discharge. Muscular, fatigue, generalized muscular weakness, muscle and joint pain, stiffness, soreness, chest pain, backache, neck muscle spasm, generalized spasticity. Nervous system, headache, migraine, compulsively sleepy, drowsy, groggy, slow, sluggish, dull, depressed, serious crying, tense, anxious, stimulated, overactive, restless, jittery, convulsive, head feels full or enlarged, floating, silly, giggling, laughing, inebriated, unable to concentrate, feeling of separateness or apartness from others, amnesia for words or numbers or names, stammering or stuttering speech. What should the person do who suspects he may have some sort of sensitivity? His first step should be to seek competent medical advice from an allergy specialist.